Okay. Hi. So the purpose of this webinar is to share information about 211's Tier 2 health programs, including MedRefer and the health programs information line. Both programs assist Cuyahoga County residents only. Other counties may have similar programs, so please use the taxonomy to find the program most appropriate for that area, or contact your supervisor to find some help. Also, all community resource specialists should address any urgent healthcare needs before referring any caller to Tier 2 health programs. While the goal is for Tier 2 specialists to accept the call immediately, if they're on another call or if it's after hours, Tier 2 may not be able to contact them until the next business day, so please clarify with each caller whether or not they have an urgent medical need and connect them to those resources whenever possible. The MedRefer program and the health programs information line do share the same profile in Refer, but it's really important that you use the appropriate taxonomy term. That way we can track how many people are looking for each individual service. The term associated with the health programs information line is personal healthcare advocate services. And of course the term associated with the MedRefer program is prescription medication services. You can find the program by using the category search by looking under 211 Special Services, or excuse me, 211 Special Projects. First I'll talk a little bit about the MedRefer program, and that program helps to link Cuyahoga County residents to free or low-cost prescription medication services. It works with people who are insured, uninsured, or regardless of their income. The program does not pay directly for medications, though. Like 211, it provides information about existing programs in the community. We also help people to navigate assistance programs by providing information, screening, applications that are populated with the patient's personal information. We provide advocacy. We educate people on the basics of prescription drug coverage. Also, most MedRefer clients are offered follow-up calls to make sure that they're able to apply and get the help that they need. Also, like 211, different programs serve people in different situations. So MedRefer staff are going to ask questions about their income, diagnosis, drug type, maybe even the strength and quantity, also insurance type, and sometimes whether or not they have assets. Also, not all medications are available free or even at discounts, but MedRefer is going to identify any available option for each client. To give an example of what MedRefer does, a woman calls for help with a copay on her insulin. She has health insurance through her job, but the copay is over $100 a month. Because she's over income for Medicaid, we decided to enroll her in a drug company discount copay card that will lower her copay amount down to $25 a month for up to 12 months. And that program has no income or asset eligibility restrictions. It was a simple 2-minute application that we did with her over the phone, gave her the billing codes to use at her local pharmacy, and the drug manufacturer will mail her a hard copy of that discount card within a couple of weeks. But it was a very quick and simple way to save somebody else an awful lot of money. The health program information line answers questions from Cuyahoga County residents about health insurance or healthcare programs that require a little bit more information, a little bit more in-depth explanation or complex problem solving. We're really trying to help people who are struggling to understand their options or their next steps to kind of make their way through these different processes. We talk to people about Medicare, Medicaid, the health insurance marketplace, and the associated subsidies or penalties. We talk about who qualifies and what those programs cover and what they might actually cost. We can also help people to navigate general healthcare services or health insurance if they're having problems. We do our best to problem solve with our callers, and we offer them follow-up to make sure that they were able to meet the need as best it could be met. An example of a caller that we may talk to would be someone who lost their health insurance when they lost their job. They'd applied for Medicaid but were denied. And the specialist was not able to understand why they were denied because they appeared to be eligible. So they were transferred up to Tier 2 to try to talk a little bit more about why they may have been denied, to just kind of go over the general qualifications for Medicaid, the different categories that might have impacted their denial, to really ensure that they really aren't eligible, and also give them some different options. So we would go over the timeline for something like the health insurance marketplace, helping them to understand when they could apply for coverage, also talk about the different subsidies, what the plans may cover, kind of just the general structure of the marketplace, just so that you have a place to start. We would also then contact or connect them with a health insurance navigator who could walk them through the entire process, or at least connect them with the toll-free number or the website where they could apply for coverage. Then, of course, we're going to explore with them if they have any immediate health care needs, because the marketplace can take 2 to 6 weeks to enroll in, depending on the time of the month that you're going to apply. So we want to make sure that we've got all those needs met. They have a plan of action until they can get health insurance coverage in place. So again, both programs do serve Cuyahoga County residents, so any calls that you're going to go ahead and make incomplete to one Adrienne Price should be from Cuyahoga County. And so, of course, this is the process that you're going to use in Refer. We would ask you to enter in the person's name, their phone number, and if you could read back the phone number to the caller just to make sure that you entered it correctly, and just put in a word, perhaps, that says prescriptions or insurance or something else, just so we understand, what is the topic here that we need to address with the person. And if you note, that just gives us a general summary or really just a comment that tells us where to start with that person, just so that they don't feel like they have to start all over again. But there's really no need to enter a full summary of your call with that person or get their insurance name or drug names, anything like that. We're going to go over that information. We don't want you to have to go over that and then we're just going to ask them the same stuff. So let's see what else. Oh, we want to make sure that you make the call incomplete in Refer before you transfer this call over to us. That way, when that call comes in and in contact, we can see the information when that call comes in. Otherwise, all that you took the time to list, we have no idea what you're talking about. So it's really helpful to see that information before that call comes in. So also, and remember that transfer goes to Tier 2 Healthcare, not to the healthcare line. Healthcare line is just going to send that call back into a loop to you, and we don't want that. So if you have any questions, please contact your supervisor or consult a Tier 2 specialist. Okay? Thanks.